Hello, my name is Nicholas Jubilee, and today I'll just be talking a little bit about my research that I performed this summer titled Assessing Risk of Bias in Studies on Opioid Stewardship Practices. So just for a little bit of background, pain management is definitely fundamental in providing high-quality healthcare. When you're taking care of a patient and they're in pain, they can easily become frustrated, upset, a little bit aggressive, or even just dismissive. And obviously, when those things are happening as a nurse, it's hard to make sure that the patient's being taken care of and you're providing such a high standard of care. And also, we also know when patients are having a lot of pain, they're placed on opioids, and opioids tend to have, well, we know they have high risks, such as misuse, abuse, and addiction. And when we're looking at opioids, it's really, really important to understand that we need opioid stewardship practices because by having opioid stewardship practices being implemented that are valid, it decreases the amount of opioid associated risk. So, for the objective of the study was to determine the strength of the evidence on the effectiveness of opioid stewardship practices. And we did this by evaluating the risk of bias in recent studies on opioid stewardship practices. So, for our methods, what we did was we did a systematic search on PubMed, looking for RCTs published no later than 2018 in English as a primary language and done in the US. And for evaluating ROB, or risk of bias, we did this using the Cochrane Collaboration Risk of Bias tool, and there was a primary reviewer and a secondary reviewer. I was the primary. So with risk of bias, you have 7 different domains, all domains looking at different potential sources of bias, either internally or externally in the study. And within each domain, there's a different set of criteria, and based off the criteria that are or are not checked off within each domain, that left the domain being ranked as high, low, or unclear for ROB. So with ROB, it's really important to understand what bias is. So bias is essentially just a deviation from the truth or even systematic error, and then bias can lead to either an underestimation or an overestimation of the true impact of the interventions being implemented. And then with ROB specifically, it's looking at potential sources of bias, either internally or externally in a study. So for the results, we looked at a total of 13 different RCTs, with there being two types of opioid stewardship practices. First type being multi-component interventions, and the second type being patient education and engagement. Opioid stewardship practices were actually associated with decreases in opioid prescribing or doses, and then all studies had high risk of bias in one or more domains. This is essentially because, solely due to the nature of these studies, if the intervention is being more patient education, you have to make sure that the patient knows what's going on. You can't just leave them in the dark. So that's why there's high risk of bias. And then for the conclusions, so the evidence on the effectiveness of opioid stewardship practices is actually limited, and this is solely just due to there being high risk of bias in multiple domains. If we look at the figure in the middle, there is a lot of X's or red X's, and this is indicative of there just being high risk of bias. And then if we're looking at the column all the way over to the right, the overall risk of bias is high in 12 of the 13 studies that we looked at. And then future studies on opioid stewardship practices need to be done, and they need to be further just to reduce the amount of opioid-associated risks that are happening here in the United States.